morning, everybody. Aloha. Thank you for coming. My name is Maria Grams, and I'm Executive Director of Mental Health America of Hawaii. And we have been here in Hawaii for 70 years, promoting mental wellness, preventing mental illness, and improving the care of people who have mental health challenges. So what we're going to do today is we're going to have an hour in which I will ask the panelists questions, and then you'll have an hour to ask questions. Full disclosure, I'm a lesbian, I'm a parent, I've been in a relationship for 30 years, and we actually are legally married from the state of California. Yeah, we got married in that little window, you know, when it was legal. I'd like to introduce our panelists. Dr. Bob Bidwell is Associate Professor of Pediatrics and Director of Adolescent Medicine at the UH John A. Burns School of Medicine. He provides medical care and supportive counseling to LGBTQ youth in adolescent clinics at Kapiolani Medical Center for Women and Children, the Hawaii Youth Correctional Facility, and the Juvenile Detention Facility in Kapolei. In the early 1990s, he chaired the Gay and Lesbian Task Force that conducted the first study of the experience of growing up gay in Hawaii. Dr. Bidwell co-facilitated an LGBTQ teen discussion group on Oahu for 18 years. To his right is attorney, law professor, Linda Hamilton Krieger. She grew up in Hawaii and returned home 4 years ago to become a professor of law at the William S. Richardson School of Law at UH. She's also the director of the Ulu Lehua Scholars Program. She worked for many years as a civil rights attorney in San Francisco, addressing sex and race discrimination and other workers' rights issues. She was also a political activist in San Francisco in the gay and lesbian community, and took an early leading role in several community organizations which emerged in response to the AIDS epidemic in the early 1980s. Currently, she is also chair of the Civil Rights Commission of Hawaii. To her right is Petty Officer Second Class Jeffrey Priela. He has been in the Navy for 6 years and has been at sea, shore, and boots on the ground in the Middle East. He is an active participant in the military LGBT group known as OutServe. He serves as the Hawaii chapter leader, the Active Serving Leaders Board, the Scholarship Committee, and was recently voted as the chairperson for coordination of nationwide Pride events. And he might have to run out of here in case there's a military emergency. At the end of the table is the Reverend Dr. Jonipher Kupuno Kwong. He is the new minister at the First Unitarian Church of Honolulu. Jonipher has recently been the executive director of the Counseling and Spiritual Care Center of Hawaii, as well as the Asian Pacific Islander Equality Los Angeles, an LGBTQ rights advocacy group in Southern California. He has worked on campaigns, been minister of many congregations, and considers himself to be a social justice minister. Besides having served as in several Unitarian churches, in one currently, he has been United Methodist, Episcopal, and has sat with the Honolulu Mindfulness Community, which is Buddhist. So I'm going to start asking some questions. Bob, is it possible to describe a typical LGBTQ youth?
Hopefully I've had time to gather my thoughts. And the question, I believe, was, is it possible to describe a typical LGBT youth? And I think it's sort of a complicated answer that's kind of developing in my mind. I think that the short answer is no, that our LGBT youth population is very diverse in its background, and the more that we're learning about the experience of growing up LGBT, the more we understand that there are like 1,000 different paths in their development. In the old days, people would try to develop kind of developmental stages for gay youth or lesbian youth. and bisexual youth and adults. But now we know that that probably was an oversimplification, that in fact there are 1,000 different trajectories of youth development. I think the most obvious is that a gay male youth, their experience is not the same as a lesbian youth, is not the same as a bisexual youth, is not the same as a transgender youth. But even more than that, I think you can't really describe what it's like to grow up as a lesbian youth, because a lesbian youth growing up on Molokai is not the same as a lesbian youth growing up in the Kaliki area of Oahu, is not the same as a Micronesian lesbian youth. So I think we need to see our young people as individuals, and I know that as a pediatrician, a lot of my work is involved in teaching younger physicians and med students about how to work with LGBT youth, is to spend a good part of our time listening to their stories, listening to their experience, and then base our counseling and our attempts to help on their individual experience. On the other hand, so that's one part of the answer. The other part is that when we first began to look at LGBT youth and their experience, which I think the research began back in the late 1960s in Seattle, and then there's been a whole flood of research since then. The research seemed to describe a population that was where the experience was primarily one of risk and danger. It was describing how the risk of suicide and depression and anxiety and runaway behavior, involvement in prostitution, exposure to HIV and other STDs was tremendously high in this population. And that was kind of the first wave of research of describing kind of a typical LGBT youth was a youth facing all these risks. Now we know that is not true at all. Certainly there is a significant minority of LGBT youth that face those experiences. But your typical LGBT youth right now.
Excuse me, is there a buzz? Yes. Okay.
So I guess what I was saying is your typical LGBT youth right now at noon on a Wednesday is a kid going to school at Roosevelt High School or Farrington High School, Radford High School, pulling A's, B's, C's, involved in football or paddling or debate club or chess club, not involved in all of those high-risk behaviors. So if there is a typical LGBT youth, that's the typical youth. And I think it's important to know that, because there are some people in the beginning that said, well, of course, this was a really high-risk group, they're gay. You know, that comes with the territory, and now we know from the research that there's nothing innate in being LGBT that puts them at risk, that when they're provided with love and support and nurturance, they grow into healthy, happy, fulfilled LGBT adults. And so that's kind of a complicated answer to that question, but.
Thank you. Linda, do you think schools should address the fact that there are some kids having gay parents?
So the question is, do I think schools should address the reality that some of the students at the school have lesbian, gay, bisexual, transgendered parents? Short answer is yes, I very much do. Not only do I think schools should address the issue, I think schools do address the issue. So let me explain what I mean by that. I raised 3 boys, one my son, 2 my partner's sons, and the 2 younger boys were the same age, are the same age. They're all grown now. And the 2 younger boys went to 2 different schools. This was in the Bay Area. My son went to a parochial school. It was actually an Episcopal school. And my partner's son, the same age, went to another school, a private school that was not religiously affiliated. And they had 2 very different experiences. At my son's school, they started talking about families in kindergarten, and they talked about gay families in the same context that they talked about all different kinds of families. Families where there were, single-parent families, extended families where grandparents were living with the rest of the family, interracial families, same-sex couples, so LGBT families, families with children who are adopted. So it was simply part of the discussion about people being different. And I had the opportunity to watch how the issue was handled from the time that he was a kindergartner, and the kinds of discussions that were had until he graduated from that school in 8th grade and then went to Berkeley High, which is a very large public school in Berkeley, California. The other boy, Danny, who went to the non-religious school, there was no coverage of LGBT families at all until the kids were in high school. And with both kids, around the time that they were 9, other students started using the word gay as an epithet, right? Oh, that's so gay. Oh, you're so gay, right? Or he's so gay, or that shirt is so gay, right? It was clearly not a good thing to have your shirt be gay. And Danny would come home from school often in tears because he had, during the course of the day, heard the word gay used as an epithet upwards of 25, 30 times, right? And Tito, on the other hand, this just didn't occur at his Episcopal school. And every year, the discussion that the kids were having changed somewhat, right? So this fear that children at age 5 or 6 or 9 or 10 are going to be talking about, homosexual sexuality, this is of course not true. This is not how we talk to children about any of these kinds of issues at that age. So what I see to be really quite irrational fear that if schools deal with the issue that there are some kids who come from families that are different than other families, right? That somehow this is going to confuse children or frighten children or undermine parents' values education with their own children. I really think that these fears are overblown. We can deal with this issue in an age-appropriate, developmentally appropriate, religiously appropriate, culturally appropriate way, the same way that we deal with other differences.
Thank you. Jeffrey, what did the repeal of Don't Ask, Don't Tell mean to you personally?
Well, the repeal for me was a bit of a godsend, if you'll excuse the pun. It allowed LGBT members, well, LGB members in the active duty service to finally come out to their peers, to their, I'm sorry, I'm choking. Come out to their commanding officers, their chain of command essentially, and really be themselves. A while ago, I gave an interview on the day of repeal outside the Arizona Memorial, and I quoted a portion of the Sailor's Creed. At the end of it, it says, "I'm committed to excellence and the fair treatment of all." Well, now it's more prevalent, now that Don't Ask, Don't Tell has been repealed. For me personally, yes, it's a liberating experience, but it's just like any other day for me. Now, I know I can't say that for everyone in the military, because we all have different experiences, but for me, in order to legitimize my position, I had to be professionally adept at my job. I had to present myself professionally. I had to carry on with my core values of honor, courage, and commitment. Just carry on doing the mission and getting it done. And that was my way of dealing with any stereotypes, any homophobia. And if there was homophobia, even under Don't Ask, Don't Tell, there were procedures to deal with it. We had command equal opportunity officers that we can go to. We can address it at the lowest level, and then we can move it up the chain. But I think now that the repeal has happened, it's opened up a great deal of possibilities, especially for the active duty gay community.
Jonipher, could you tell us what religious institutions are supportive of LGBTQ, and then if you're comfortable telling us which ones aren't? I don't think it works.
Can everybody hear me? Great. Thank you, Maria. Well, there is actually a spectrum of how open and how welcoming religious institutions are. Some of you may have been taken aback when Linda was describing how this Episcopal school was so open to LGBT people and doing healthy sexuality education at a young age of what different families look like. And indeed, more and more so, that seems to be the trajectory, especially within mainline Protestant Christianity. And so over the years, there have been several designations made as to what you would call such a congregation. So in the United Church of Christ, for example, or the UCC, which is what this church is, the Central Union Church, those who are welcoming to LGBT people are called open and affirming. And in Presbyterian circles, those are called more light congregations. In Lutheran circles, they're called reconciling in Christ. In Methodist, they're called reconciling ministries. And in the Catholic Church, they're called anomalies. Sorry. Couldn't resist. And in Jewish traditions, they're called normal, right? Especially the Reform and the Reconstruction side of Judaism. So there's various levels and various degrees, and for those of you who are interested, I actually came up with a very crude mapping and a spectrum of how welcoming certain denominations and certain religious groups are compared to others. And I thought I was kind of clever in terms of labeling them red versus blue congregations, you know, and so you could just guess where some of the more progressive ones are. And, you know, many of you have probably heard recently, too, in the news that several denominations have even started ordaining openly LGBT folks to the ranks of clergy in their denomination. And so, you know, what I go back to is actually a comment that a colleague of mine from the United Church of Christ made, which was that unless a church is open and affirming, it's not a church of Jesus Christ. Meaning that would Christ be welcome in the midst of the congregation if he were to step into a church service, you know, or would there be a bouncer at the door saying, only you can come in, or only you can come in, but not you and you and you because of who you are. And so that really struck a chord with me in terms of how we do business, so to speak, as a church and as religious institutions, and how welcoming we are of people. And by the way, I forgot to mention my own denomination, which is Unitarian Universalists, and the designation for us is welcoming. And we have over 60% of our congregations that are designated as welcoming congregations. So for us, it's pretty much a non-issue. And in fact, you know, on the mainland, if you were to say that a church actually called an openly LGBT clergy person, they will just yawn at you and say, yeah, so what? You know, and we've been doing that for years. But here in Hawaii, I'm actually the first openly LGBT or queer person to be called as the settled minister for our congregation. So needless to say, we have a lot of work that still needs to be done in order to open up people's hearts and minds towards this issue. But I think time is on our side, and this next generation, because even evangelical Christians these days, the young folks are very open to LGBT folks. And I think that's partly because they know a friend or a friend of a friend who's LGBT. So the more you get to know us, the more you get to know that we're just as boring as anybody else. And, you know, we're as normal can be, and we still squabble and fight over issues like who takes out the garbage, you know, at the end of the day. So I'm actually quite optimistic that this is also the direction that religious institutions are going, and just as much as we have gotten over the issue of racial discrimination and the issue of slavery,
And the issue of women being ordained, I think this is just the next step in terms of recognizing that we are all made equal in God's image.
Thank you. Jeff, I'll make it convenient with this one. Jeff, Don't Ask, Don't Tell, Don't Ask, Don't Tell was repealed, and we've heard in the news that it went very smoothly. Is that your experience, that there were no incidents or reprisals?
Yes, it did go smoothly. There wasn't any negative impact at all in terms of mission accomplishment, getting jobs done. It was just, I mean, for me, the only thing that I got was, oh, well done, you look very good on TV, you look very professional. Thanks. There was no negative repercussions, and even within the OutServe network, and it is a very large network, we've got about 48 chapters worldwide, including the continental United States, there hasn't been any significant impacts. In fact, we just treated it as business as usual. It's like, oh, you gay? Well, get back to work. So, in a nutshell, no, there hasn't.
Great. Linda, what was it like for you to be a lesbian in college in the early 1970s?
You know, things have gotten better. I don't know how many of you are familiar with the YouTube series, It Gets Better. But it certainly has gotten better in many parts of the country over the last, is it really 40 years? Being a newly out lesbian, even in the San Francisco Bay Area in the early 1970s, was extraordinarily difficult and painful and psychologically injurious. I'll come right out and say that. I was one of those LGBT youth who was at risk of suicide and did actually come all too close to committing suicide, and who has struggled for many years with the effects of depression, anxiety, and post-traumatic stress disorder over some of the things that happened to me as a young person, trying to figure out who I was and what that meant. I grew up actually here in Hawaii, and I realized when I was 13 that I was a lesbian. But I did not come out until I got to the mainland to college. I did not perceive Hawaii as a safe place to talk to anyone about my sexuality. And silly me, I so thought that it would be all right to talk to people in the Bay Area, and it was not. I had quite a bit of difficulty in my dorm. I was sexually assaulted by a group of men in the dorm, one of whom was the resident manager. There was, you know, during the early 70s, there was no one to go to talk to about things like this. There were no complaint procedures. I mean, one of the perpetrators of this assault was my resident manager, who one would think would be the person that you went to with a problem, right? I was harassed very severely in the cafeteria, in the dining hall, and so stopped taking my meals in the dining hall. I actually ate out of my rice cooker in my room. Every, you know, college kid I knew from Hawaii took their rice cooker. They didn't take, the other people might take popcorn poppers, but we took our rice cookers, so I ate out of my rice cooker. And it was extremely bad. And I think there are still far too many, you know, there are far too many places and spaces in our country where things are still quite bad for LGBT youth. I think this is particularly true now for transgendered youth. I think that things are worse for the transgendered community than they are for the LGBT community, and I think we all need to be doing as much as we can to assist in that struggle. I think it is it's the same struggle, it's the same fight, but it's harder, I think, for